Adult stem cells. Adult stem cells are also called somatic stem cells. Boston Children's Hospital describes adult stem cells as cells that produce the different kinds of cells that maintain the body's tissues and organs, and, importantly, they have the ability to divide and reproduce indefinitely. Adult stem cells have two major characteristics. One being they can make identical copies of themselves for long periods of time, and another being they can produce different kinds of cells that can then produce tissues and/or organs. There are many types of adult stem cells, but to name a few, there are mesenchymal, hematopoietic, and neural stem cells. Mesenchymal stem cells are adult stem cells that form fat cells, cartilage, bone, tendon, ligaments, muscle cells, skin cells, and even nerve cells. Hematopoietic stem cells can only create blood cells, and neural stem cells can only create cells that are in the nervous system. Now, where do stem cells come from? Well, for one, they come from the body. They're found in the brain, bone marrow, blood vessels, skeletal muscle, skin, teeth, heart, the gut, and the liver, to name a few. Stem cells are already found in the body, and they're special because they divide and create new cells only when they're activated by injuries to tissues or by diseases. In the body, mesenchymal and hematopoietic stem cells can be found in bone marrow, and neural stem cells can be found in the brain and spinal cord. The second place that stem cells come from is amniotic fluid. This fluid, which bathes the fetus when it's in the womb, contains mesenchymal stem cells, which can make a variety of tissues for babies during development. The third place adult stem cells can come from is from other pre-existing adult stem cells. Transdifferentiation is when certain kinds of adult stem cells differentiate into other cell types. For example, a brain stem cell differentiating into blood cells, or a hematopoietic stem cell differentiating into a cardiac muscle cell. This is very rare, but it can happen. So how are stem cells used in treatment? Well, they're used in an approach called regenerative medicine, which is the clinical use of stem cells to repair tissues lost to damage or decay. For instance, stem cells can be used to provide more insulin-producing cells for people struggling with type 1 diabetes. Mesenchymal stem cells from amniotic fluid in the womb can be used to grow new tissues for babies who have birth defects. The most common form of stem cell treatment, bone marrow transplants, use stem cells from bone marrow to infuse the blood. These stem cells from the bone marrow, once they're transplanted, find their own way to the proper location and begin forming the cells or tissues that are needed. This is a rare occurrence, and only a few types of stem cells, one being from bone marrow, are able to locate problems in the body and begin working on their own. In order for a stem cell treatment to be successful, the stem cells, if they're manipulated in a lab, must be reproduced in large enough quantities to provide the amounts needed for certain treatments. Next, they must create the correct cell types that are needed in the body. Thirdly, the treatment must be safe. If adult stem cells are manipulated incorrectly, there is a huge risk of cancer developing. Lastly, the stem cells must stay alive and remain functional for the rest of the patient's life. Otherwise, the treatment is pointless. As of success in treatments today, researchers at Boston Children's Hospital have been able to isolate lung cells, identify stem cells in the heart, and take a drug into clinical trials that will help patients with leukemia and lymphoma. On the other side, there are issues with using stem cells in treatments. Right now, scientists do not have the ability to grow enough stem cells needed for certain treatments. Scientists also can't direct the different types of cells to where they're needed in the body without going in with surgery or other invasive methods. Now, let's discuss the ethics behind using stem cells in research. For depth, let's discuss embryonic stem cells, which are stem cells that come from amniotic fluid or fetuses. There are not moral issues regarding the source of embryonic stem cells if the cells are retrieved from umbilical cords or amniotic fluid. These cells can be used for the child if they get sick in the future. On the other hand, embryonic stem cells can come from fetuses. When a fetus is aborted, stem cells can be harvested without much difficulty. Stem cells from aborted fetuses can be ethically wrong if the mother is convinced to become pregnant so her fetus can be aborted for research, but otherwise there are no immediate conflicts on a scientific scale. Not scientifically speaking, because embryonic stem cells can be harvested from human embryos that have either been naturally or purposely aborted, people who believe that embryos are living beings and that their destruction is murder do not support the harvesting of embryonic stem cells from fetuses. Now, adult stem cells. Adult stem cells are relatively free of ethical issues. They can be harvested with patient consent and can be taken from deceased humans donated for medical research. There are, however, many risks involved with the use of adult stem cells. There is the risk of tumors, the risk of migration defects, and high levels of irregularities in cells being able to find the correct location where tissue or cell reproduction is needed. There is also the risk of transplant rejection. If donor cells and recipient cells don't match, there can be serious health complications. Lastly, there are always surgical risks, with an average of 3% risk of bleedings and infection from neural stem cell surgeries. I personally think that using stem cells, no matter what type, is ethically sound. Regarding embryonic stem cells, I understand that some people may be opposed to using them from fetuses because of their views on abortion. However, I feel that if a woman is aborting her child, which I believe is a personal decision, she should be educated on stem cells and the scientific benefits of allowing her child's stem cells to be harvested. Regarding adult stem cells, I also realize and understand the risks. For instance, the 3% risk of bleedings and infection from neural stem cell surgeries, risk of tumors, and risk of transplant rejection are major factors that make stem cell treatments appear more as a gamble than a definite treatment. However, I feel like using adult stem cells for treatment is a revolutionary scientific innovation that the world should cherish and not be afraid to embrace or research.